partial we talked about, obviously only one component is replaced, typically the inside or medial side of the joint, because that's what tends to wear out faster. And again, you're just metal, plastic, metal, plastic, metal. This is an older component that was just metal and plastic. We've gone back to a metal-backed component on that side too. Same thing with the hip. The hip, metal stem, which goes into the femur, inside up to here, and then there's a little neck extension, the ball, and then the socket. Usually a combined metal, plastic, metal. This is titanium. This is usually titanium. This is the stainless steel alloy, because again, weight-bearing, any weight-bearing surface needs to be stronger. The weak link in this system is also the plastic. Because of that, that's why if anybody's heard of or has metal on metal hips or ceramics, they're all designed to decrease the wear, okay? The difficulty is they all have their own problems. The plastics that have been out in the last 5 years are a lot better than the ones that were out 20 years ago, and they're lasting a lot longer. There's a lot less wear. So we're improving that part of it. A lot of the other advances we think are good for a little while, and then something happens and they may not be so good for a variety of reasons. What you have to realize is, go back to the term artificial, okay? These are not natural things that we're putting in bodies. They're going to respond in a lot of different ways, and a lot of different things can happen. They're great operations, but nothing replaces what you were born with. Okay, let's talk about incision size. Everybody in the last 5 years has become enamored with minimally invasive and or minimal incision joint surgery. For those of you who need an analogy for this one, I'll stay away from cars. You cannot go to a dress shop knowing that you wear a size 10 and expect to get a size 2 dress. Okay? The incision size is whatever I need it to be. Okay? I can, for those of us who remember the show Name That Tune, I can name that tune in 2 notes. I will not even attempt to give you a good joint replacement through a 1 or 2 inch incision if it's not physically possible. Because the #1 reason for failure in total joint replacements outside of a complication related to infection, fracture, nerve injury, or something like that is improper positioning of the components. So if you can't see what you need to see to put the parts in right, you're wasting your time. You're not going to be happy. I'm not going to be happy, and you're going to end up having to do it again. I'm not a big fan of smaller incision. My better term would be that minimally invasive. We're trying to preserve the soft tissues a little bit better than we used to. We use some different pain management techniques which make the pain better, and you have less problems in your recovery process. It's all geared towards being able to get you up on your feet and going as quickly as possible, because we know keeping people down in bed is not good. Pain management is a big component of getting you moving. Obviously, different techniques that we can use in concert with the anesthesiologist, with nerve blocks and different things like that, can help control pain. And the big goal there is to get you off the narcotics as quickly as possible, because although they're great for pain, there's a ton of side effects that come with them. So the less you have to take, the better. Normal activities. On average, for the most part, 2 to 4 weeks once the incision heals. Okay? Now, these normal activities, they still may include a cane or a crutch or sometimes a walker. This is a little bit optimistic. I'd say the average time to some type of assisted device is probably 4 to 6 weeks as opposed to 2 to 4, but it's variable, and there's no restriction. It's not like your weight bearing is tolerated from day 1. If you need a walker or crutches, you need it. If you don't, you don't. But if your leg's still weak and it can't support you, you need it. 1 to 2 months, probably 2 to 3 months. But, you know, you can certainly, if you can get there in 1, great. But probably in my practice, the average is 2 to 3 months. Most people by 3 months are doing pretty darn well. You're still going to continue to improve as far as strength and stamina for up to a year. Here we go with the restrictions. Okay, these are not made to do these things. They will wear out. Or you can cause other damage to the surrounding bone. Okay, so basically, you got to start in the right place. Okay, don't have surgery that you don't need. Okay, and again, some people are candidates for this, some people are not. Certain disease processes, certain levels of arthritis, certain bony deformities, trying to do those with the minimally invasive techniques leads to failure.